Welcome to Module 4 of the Tobacco-Free Futures Implementation Series, Final Planning. Tobacco-Free Futures is an integrated health systems tobacco cessation model developed for Alberta Health Services to provide support for Albertans who use tobacco products. This module refers to the content found in Chapters 12 and 13 of the Tobacco-Free Futures Guidelines. Sustainability planning needs to be an integral part of the development and implementation of this initiative. To support sustainability, continued activities at the provincial and the individual healthcare setting levels will help ensure that systems changes continue and quality cessation support is ongoing.
So as with any initiative in Alberta Health Services, a program needs to have an implementation phase, but it also needs to build in some kind of a sustainability plan. So we want to make sure that these programs that have been developed are sustainable in the long run. So sustainability is an important part of Tobacco-Free Futures implementation, and there's a section in the guidelines for sustainability, but that doesn't mean that you can't start working on a sustainability plan from the beginning. Your steering committee today could look quite differently in the future, and how does that work so that a steering committee always has a role in a site when you're talking about tobacco cessation, treating tobacco dependence? And you have to go back to the different processes in implementation and re-engage. So revitalize training. Figure out what it means for your site to have training as an ongoing part of daily practice. So now that you've integrated tobacco work, everybody is doing tobacco work, how do we make sure that that's sustained and so it becomes part of our everyday work, of everyday monitoring, of everyday treatment for all Albertans?
All sites implementing this initiative will continue to receive ongoing guidance and leadership through the Tobacco Reduction Program in consultation with population, public, and Aboriginal health leadership, the Provincial Cessation Steering Committee, strategic clinical networks, and other key stakeholders. Site-based leadership will need to continue to monitor ongoing implementation of the model.
When I joined the committee, I gained a greater understanding of smokers and why smokers smoke, the resources available to them to assist them to stop smoking, and it just broadened my horizon from there, and I continued with that interest with this committee.
Management of existing resources and development of new tobacco-free futures resources, including training, will be done through the leadership of the Tobacco Reduction Program. Sites will need to continue to ensure they are making the most up-to-date resources and training available to their staff.
As for any project, sustainability is huge. I'd like to see this project just keep rolling forward, getting the staff engaged, the visitors engaged, just creating a culture here at the Rocky View where we are tobacco-free, where people are comfortable to just have that conversation.
The guidelines contain a template for a sustainability plan, which will be helpful for all sites to maintain the processes and changes they have implemented. For more information, see Chapter 12. Sustainability is key to the success of the Tobacco-Free Futures Initiative, and so is continuous improvement. AHS uses the AIW model, the AHS improvement way, to plan and implement quality improvement projects.
We're very, very strong on implementation and getting it rolling, but we need to absolutely, in order to keep it rolling and sustain it, we need to be reporting. The people who are doing the work need to hear what the benefits have been over the past year for them doing this. In terms of documentation, we have made sure that the forms are available on every inpatient unit, that they're included in the inpatient packages. We will be doing comprehensive audits in the near future, within the next month, to determine the percentage of patients that actually have the form completed on each unit. We'll be taking steps to improve that percentage where there's perceived to be a gap. So if there's room for improvement, we'll work on that. We also know that we've got numbers with respect to the number of patients or the number of drugs that have been disseminated to inpatients for smoking cessation aids or nicotine replacement therapy since the time the program was implemented. So that has increased substantially.
People continue to come to treatment. They stay in treatment. In fact, a lot of the staff continually have been saying, and a lot of them that were skeptics in the beginning and really not sure whether this was going to play out very well, are saying how pleasantly surprised they are and how they thought it was going to be so much more work for them to be able to monitor and help clients through their cravings. It really isn't much of an issue. One of the staff members I was speaking with not that long ago said that with the nicotine replacement therapy, the clients aren't even really talking about the cravings or really struggling that much. And a lot of the clients are saying, I can't believe how easy it is. And the clients will say, I've never even tried nicotine replacement. I always thought I would have so much trouble with it, and I'm realizing that I can do it. So we're just seeing lots of benefits. And now that we've been tobacco-free for a while, I think that we very rarely even hear concerns from staff either in order to support the shift into tobacco-free treatment. So, for example, we were realizing that the clients were, they spent a fair amount of time out at what we called the smoke pit, and now that they aren't spending their time hanging out smoking, we needed to find some other ways to help support them in their downtime.
As with other implementation processes associated with the Tobacco-Free Futures Initiative, having a plan based on a site's individual assessment of its context is crucial. Templates for annual quality improvement assessments and planning are contained in Chapter 13 of the Guidelines.
Once a site has completed implementation of tobacco-free futures, it's important to take a pause and reflect on the success of what you have achieved. I think, again, what we learned from the pilot sites is because often there are incremental or smaller changes made. It's not until people step back and think about where they were at the start of introducing tobacco-free futures and where they are now to realize, the degree of changes and the success that they've achieved and the improvements that they've put in place for patients and clients. So pause, reflect on that, celebrate those successes, acknowledge the champions that have helped with the successful implementation and that. The other thing that you need to start to do is to evaluate, what you've put in place and look for opportunities for continued improvement. We know from the tools that Alberta Health Services is putting in place through the Alberta Improvement Way that, just because you've put in place and changed a process, got something new happening, doesn't mean that you're done. That in fact it's important to continue to evaluate what you're doing and continue to make improvements. The other thing that we're encouraging sites and programs is to share with others and share with the tobacco reduction program their successes and experiences. So again, we're all able to learn from each other.
If you're ready, let's move on to Module 5, Considerations for Specific Care Settings and Populations.